Okay, so this is the last lecture for this module, and what I wanted to do was to give you a case study to help you wrap your minds around some of the concepts and the materials that we've covered so far. And so what we're going to talk about in this lecture is an HIV outbreak that happened in Indiana in it's about 2011 to 2016, but we're really going to focus on about 2014 to 2016. So this happened in Scott County, Indiana, which is in southern Indiana, close to the Ohio River. And in Scott County, there is a population of adults of about 15,000 people and a poverty rate of about 12.1% among families. And so that's higher than the national average poverty rate. And what happened was one of the worst HIV outbreaks in the country in the past 25 years. Between November 2014 and November 2016, the CDC reported 181 people had tested positive for HIV. In comparison, there were only 5 HIV infections diagnosed between 2004 and 2013. So this is really a huge jump. And just in January of 2015, there were 11 new diagnoses. And then in the spring of that year, they were getting 20 new HIV cases per week. So this was a great example of an epidemic, something that has eventually sort of stopped growing at this rate, but it's sort of this new outbreak of disease that's happening at a much faster rate than it had in the past in a particular location within a particular period of time. 181 people basically over the course of 2 years out of a population of 15,000 adults. If you do the math there, that works out to about 120 people for every 10,000 people, or 1.2% of the population. And just in the beginning of 2014, the incidence rate had been 0.01%. So it's a pretty big jump. And the reason that we know how many cases of HIV had been diagnosed is that there are certain diseases, and HIV is one of them, that doctors are required to report new cases to the state health department. So things like, these more serious diseases like HIV/AIDS, or things like Ebola, smallpox, Zika, things like this, that the state health departments want to monitor any outbreak of disease in the state. And so that's how we have these numbers of the number of people who were tested positive. So why did this outbreak happen? Well, I'm sure you all have some, hopefully, understanding of HIV and how it works. HIV is contracted through bodily fluids, so you primarily contract HIV through unprotected sex or through intravenous drug use. And so we know biologically what happens, how the disease is passed from one person to another, but what we need to understand is socially what explains this outbreak. How is it that, what is the mechanism, what is the pattern that explains why so many people were getting HIV? And so the Centers for Disease Control, the CDC, sent epidemiologists in to investigate. And what they did, or they have these people called disease intervention specialists, right? They're a lot like this Jon Snow character that we talked about last time. And what they do is they do what's called contact tracing. So they talk to diagnosed individuals, and they have them list the people with whom they had either had sex within the last year, or people that they'd shared syringes with in the last year. And then they also ask them about HIV testing and about people that they know who might benefit from HIV testing. So maybe this isn't a person that they'd shared needles with or that they had sex with, but that they know to potentially be somebody who should be tested for HIV. And so what these disease intervention specialists did was they diagrammed the connections between the patients and the people that they had contact with. And so what they found was that the outbreak was not so much tied to sex, but mostly tied to sharing needles. So 173 or 91.9% of the people who had HIV reported injecting any drug in the last year, and 159 of those people were using a specific opioid called Opana. And so, just as a sort of side note here, what's interesting about Opana, this is a prescription opioid pain medication that people were taking, likely because they had been obviously had some pain and had been just prescribed it from the doctor, and then perhaps they started to develop a dependency on it, or perhaps there are people who were just using this pill recreationally. Regardless, what people had started doing was crushing Opana and snorting it. But the manufacturer, whose name is Endo, the company's name is Endo, when they changed the formula on the coating of the pill, it made Opana harder to crush. And so what people did was they started to cook the pills and then inject them because they could no longer crush them and snort them. And so this led to people sharing needles. Now, what's also of interest in the larger social context, right? We're sociologists here, we're thinking like C. Wright Mills, is that needle exchanges were illegal in Indiana at the time. So, needle exchanges are a program where if you're a drug user who injects drugs, you can take your needle to some needle exchange program. You can give them your dirty needle and they will give you a clean needle. Now, this is really controversial because there are a lot of people who argue that this just continues to let people use drugs and it doesn't do anything to stop people from using drugs, and we shouldn't reward drug users by giving them clean syringes. The other side of the argument is that people who use drugs are addicted, and it's a really big problem, and it's very difficult to get them to not be addicted anymore or to get them to stop using drugs. That's a very big challenge. And so people who support needle exchange programs argue that these programs help stop the spread of disease among a group of people for whom they may never stop using drugs. They realize the difficulties in getting people to stop using drugs. And so they just want to make sure that they are helping prevent the further spread of any disease if possible. So that kind of program was illegal in Indiana at the time of the outbreak. And in fact, you could be arrested in Indiana for carrying a needle. And so people just reused them and shared them to avoid getting into trouble with the law. So what the disease intervention specialist also found was that this was a very densely connected network. Dense meaning very tight-knit. So everybody knew everybody, and it seemed like a lot of the people were using with each other. And there were also about 20 women who reported engaging in prostitution. They felt that they had to turn to prostitution because they needed money, perhaps to pay bills, or they needed money for drugs, or they were engaging in prostitution directly for drugs. But that also introduced a component of sex into this issue. So, as I said, mostly about sharing needles, but there is some potentially unprotected sex happening as well. And then one other thing that their investigation uncovered, or probably not uncovered, everybody knew this, but there was no place in the county for HIV testing because there was one Planned Parenthood that was the only place in the county that did HIV testing, and in 2015 that Planned Parenthood was defunded. The federal government took funding away from Planned Parenthood, and that Planned Parenthood had to close. So in 2015 there was nowhere to get HIV testing in Scott County, Indiana. And so what was the response to the outbreak? Well, the CDC recommended interventions that included a huge increase in the number of people tested for HIV. And they also assisted with monitoring people who were diagnosed with HIV to make sure that they attended their appointments and that they started taking HIV medications. There was also a needle exchange program instituted And as I said, it's very controversial. There's evidence, though, that shows that the needle exchange programs work. So, for example, in the 1980s, about one half of IV drug users in New York City had HIV. Today, there's about 100,000 drug users, IV drug users in New York City that we know of. This is about 4 times the population of Scott County. But new cases of HIV among New York City IV drug users is lower than it was in Scott County in 2015. So there is evidence to show that these programs work, and the CDC recommended that this kind of program be instituted in Scott County. And so in April 2015, Scott County instituted a needle exchange program, and it was intended to be temporary, even though the outbreak was almost entirely due to sharing needles. And so then in May of 2015, the governor at the time was Mike Pence, and Mike Pence signed a law allowing any county to set up a needle exchange program if they could prove that they had an HIV epidemic. Now, later in 2017, 2 counties ended their programs, in part because they were concerned about the management, but also because of the sort of like moral component of the needle exchange programs. But then later in July 2018, one of those counties ended up resuming their program. And so the CDC ended up actually doing a study of IV drug users in Scott County, and what they found was that this exchange program actually did reduce the extent to which people were sharing needles in Scott County. So it did have a positive effect on the sharing of needles, and did positive effect meaning that in the benefit of health, that it was good for people's health. They were not sharing needles as much as they were. So if you think about this through the ecological model, you can see each of the 4 outer layers in this case study. So at the interpersonal level, you have drug use as a community activity, really. This was something that was sort of part of people's social lives, and it was something that was found in a really tightly connected social network. And so people were interacting with each other. The drug use was likely one of the main sort of like reasons that they got together, perhaps. So you see it at that level. At the organizational level, right, this is where we think about social institutions. So access to medical care would be like a kind of, that would be an example of a social institution, would be medical care. And so you see here that the Planned Parenthood is closed and there's nowhere to get HIV testing, so people couldn't even be aware that they were carrying this disease. At the community level, you see things like high poverty. So people, especially women, are turning to prostitution in order to make money, and this sort of contributes to the issue. You see a lack of jobs, same sort of idea. You see, in particular, if you think about the cultural values and the norms of the community, what you see is a stigma around drug use and a stigma around this needle exchange, and this religious and moral objection to needle exchange, right? So in rural communities where this kind of stigma is really prevalent, rural communities are also being very hard hit by the opioid crisis. We're going to learn about this later on, but this could be, this cultural view of needle exchanges could be a barrier to helping reduce the spread of disease. And then at the public policy level, you see that policy really does have an influence, right? You see the national policy to defund Planned Parenthood had an effect at the organizational level. You see that the laws against carrying needles or needle exchanges initially had an impact on the way that people behaved, and the fact that they were sharing needles with each other. And then the policy to implement needle exchanges has, according to the CDC, reduced the amount of needle sharing that was happening. And so public policy has a really strong effect in this particular case. So I hope that this case study has sort of illustrated some of these larger concepts for you and helps you think about how we could take a sociological perspective and apply it to a public issue like HIV. So that's it for week 1. I hope that you're all able to get all of your work done in the short week that we have. If you have any questions, please feel free to send me an email. And don't forget that by Saturday at 5 o'clock, I need you to make sure you're in touch with your group and that your group has chosen your topic for this term that you're going to do your presentation on. More information can be found on Blackboard, but if you have any questions, feel free to shoot me an email. Have a great week.